Time is everything in a heart emergency. A few minutes is what stands between life and death. A few days back, I got a call from the emergency that a young guy in his early 30s had come to the ER department with complaints of chest discomfort and vomitings. He was throwing up regularly, but the family thought that this was some sort of a gastritis, so no heed was paid to that. When he reached the emergency, we took an ECG and it was detected that he was having an acute heart attack. His blood pressure was very low. He was extremely irritable because of hypoxia to the brain, and an immediate ventilation with a mechanical ventilator was done by the ER team. We knew that we did not have any time with us. I tried to speak to the family, but I realized that there is no family with him. There were a bunch of young kids who were partying with him who had brought him to the emergency room. I explained them the gravity of the situation, and very sanely they took a decision that whatever needs to be done had to be done. So this guy on mechanical ventilator with very low blood pressures and with the support of multiple blood pressure support medicines was transferred from the emergency room to the cardiac catheterization lab. When he reached the lab, even before I could do the procedure, he had another episode of ventricular tachycardia. He was shocked again. Another episode of VT. Shocked again. Even before we could do anything, he had to be shocked 3 times. The window in which we had to operate was very, very narrow. The cardiac anesthesia team, led by Dr. Anup Naval, was with us, and we were continuously monitoring how we can get that 5 minutes to operate on him.
In the early morning hours, received a call from emergency that there is a young patient who has come with cardiac arrest. The emergency team has revived him, and he was put on ventilatory support, inotropic support, and he is having arrhythmias. And as discussed with the cardiologist, Dr. Ashish, he is an acute MI, and the decision was to shift him urgently to the cath lab and do the angiography. But the only good thing is his rhythm was stable.
Got that window, and we did an angiogram, and it expectedly showed that one of the largest arteries of his heart, the LAD, was blocked right from the beginning. An immediate angioplasty was planned. I discussed it with his friends, who were very, very intelligent bunch of people. They decided that it has to be done immediately, and we opened the artery within a span of 2 to 3 minutes. The blood flow started. We thought that this is it. He should come out of it. But again, he had an episode of cardiac arrest. The heart, when it is irritable, can have such complications for a prolonged period of time. He had to be shocked again. And surprisingly, for the next 10 minutes, he was given 7 shocks to revive him out of ventricular tachycardia rhythm. Medications were escalated, he was supported, and after 15 to 20 minutes, the ventricular tachycardia settled. His blood pressures were very low, but still we had hope. We believed that once he gets a good post-operative care, this guy can make it. He was shifted to the ICU. His blood pressures still were like in around 60-70 millimeter of mercury. He was put on inotropic support, but we were relieved that there are no more episodes of VT. I left the scene and believe that when I come in the morning, we would find that he is improving. Cut to the next day, when I reached for my rounds, I discovered that there is no episode of VT, but his blood pressure continued to be very low. His urine output has significantly decreased, and his ventilatory requirements were very high. We did not have much scope of escalating the medicines as they were already at maximum dosage. So now what to do? At that time, we decided to take a chance with what we call as the ECMO therapy. ECMO is a therapy which acts as an artificial heart, supporting patients when the heart's pumping is really poor. In this case, the patient's pumping was hardly 15 to 20% of what it should be. So, a detailed discussion happened with the family. By this time, the family who stays at Kashi, they had come. We discussed with them, and we decided that it's the time when we should be aggressive and should not waste any precious moments. The ECMO therapy was started, and I would say in next 6 to 8 hours we could see that the results started to come in. The support medicines which we had given to him, they started to come down. His urine output improved absolutely to normal, and the acids inside his body had started to decrease. This gave a lot of hope to us. And in another 12 hours, the next morning, we could see that his blood pressure support medicine requirement was down to nil. His urine output was totally normal. His kidney functions were improving. His liver functions were improving. His ventilatory requirements were going down. We did an echo and we found out that the pumping of the heart from 15-20% has risen to 25% or so. This was a miracle. We were so happy that the guy is improving. He was still not out of the woods, but we were very sure that he is on his path to recovery. After 24 hours, everything happened expectedly. We could take him off ventilator. After another 12 hours, he was taken off the ECMO support, and when we did an echocardiogram, we found that the heart function has improved to 45%, which is a fantastic recovery in 48 hours. After a 2-day stay in the hospital, in the ICU, and another 2-day stay in the ward, this guy is getting discharged today. And the whole team cannot be more happy.
Hi, my name is Puneet Mishra and I'm a cardiac patient, and the day I get admitted on this hospital, Fortis, that 23rd of September, and I got it's unbelievable pain, so I come with my friend Vishu and Saurabh. I attend. The doctor is Ashish Gupta. He's treated me, and I think he's an excellent experience about this, and his job is a very good. So that all my friend, my brother, mother, sisters, everyone is here. And that time I admitted over there, my heart was working only like a 15%. Now it would be quite good, 45% it will be work right now.
We were sitting, he suddenly started having some issues regarding his heart. We were very, at the time we didn't had the time to think. We brought him to the hospital, and here we got to know that he got the cardiac arrest. And the situation was very critical, and doctors was not sure that how he gonna respond, because his arteries was blocked, his heart was on only working 15%. So doctors were dicey, but they were very quick. I'm really happy that we brought him here. The team of doctors here is excellent. They did a very great job. Where we didn't had the possibility of saving him, right now he's sitting with us, he's smiling. He has recovered well.
Today we are at this situation where we can say that yes, my patient is okay, and we are very happy. At the same time, I would love to appreciate all the doctors, especially Dr. Ashish Gupta. He has taken very vital decision and very aggressive decision to save Puneet Mishra's life. It is very great help. By God's grace, we could able to save his life.
Hello, so we are really thankful for the team of doctors, and really thankful for Ashish Gupta sir along with his team, and we really wish that nobody has seen this situation, but yeah, still we would like to say that we are really thankful, because if he would not be here, I don't think things gonna go which way. And other people were also there, the other staff, the junior doctors, each and everyone was there. The staff was great, very attentive, very responsive as well. So yeah, really thankful for the team and everyone, the care which they have shown in this 1 week of time.
This would not have been possible without a combined effort of doctors, of staff nurses, technicians, right from the emergency department to the cath lab and to the ICU. Today, the gentleman is with his family. We belong to the holy city of Kashi, and the whole team is so very proud of our work, and also we look at the kindness that God has showered on him and on us.
Thank you,
Dr. Sir.
along with the team.
Along with the team and Fortis Hospital.
Fortis Hospital. Thank you very much.